Hi, this is Brian Kim. I'm going to share with you capsular fornix hydrodissection in a small pupil with a corneal scar. I feel like hydrodissection is the unsung hero of cataract surgery, and people have a variety of ways to do this technique, but I do feel that there are nuances in how to do an efficient and very reproducible technique. And so I am going to show again how capsular fornix hydrodissection does provide a very consistent way to get a nice hydrodissection fluid wave and be able to spin the lens even when you have very poor visibility in this cloudy cornea as well as very small pupil. So I have plenty of videos that I have on my channel, but just to review, you place the cannula out underneath the anterior capsular rhexis edge, and then you rotate the tip downward, and then you get a very nice fluid wave which propagates. You turn the tip out, make it horizontal again. You slide it out of the capsular bag, decompress on the left side, and then spin the lens on the right side. But how do you know if the tip is in the correct place if there is poor visibility, such as in a cloudy cornea or a small pupil? Well, the key is you see this blue line. Imagine that's the capsular fornix in the most peripheral aspect horizontally. If you push the cannula towards the periphery, it will abut against the capsule. You'll see a very subtle movement of the capsular bag. You'll actually see the cataract in the bag just slightly shift towards the cannula tip as you push against the capsular fornix. And that's because as you push on the capsular fornix, it causes the lens to shift a little bit. When you see that very subtle movement, that means you've reached the capsular fornix. You stop, rotate the tip downward, and you're able to push the fluid wave, and you'll get a really nice, very easy flowing hydrodissection wave. And then you can decompress the bag and then spin the lens. So let's see an example of this case in a slightly cloudy cornea and small pupil. I'm going to place the cannula out underneath the anterior capsular rhexis edge. As I go to the periphery, you see the small nudge. I stop, rotate the tip downward, get a nice fluid wave, rotate the tip back horizontally out, decompress to the left side. You can see the lens is already loose. I go to the right side, turn the tip slightly downward, and I'm able to rotate the lens very nicely, very smoothly. And so I'm going to break this down. Let's show this one more time. I'm going to go ahead and place the cannula out underneath the anterior capsular rhexis edge. You see that movement? That is the movement right there. That's that subtle movement of the bag towards the cannula tip as I'm pushing it peripherally. You stop, rotate the tip downward. You see a beautiful fluid wave that begins. You can see that because I'm rotating the tip. You see that circle there, that means I have to rotate the tip back up, make sure the tip is horizontal to the iris plane, and then you're going to take it out of the capsular bag, decompress on the left side, and then you can see the lens is spun on the right side. So this is why I feel like this is the best hydrodissection technique. You can do it with poor visibility. You can very consistently place the cannula tip into the capsular fornix. The fluid wave always propagates posteriorly. You get a reliably reproducible hydrodissection wave this way. It's very safe, and you have a very clear visual cue that you're within the capsular bag, and you're able to get that nice fluid wave, again, by visualizing when you're sliding that cannula tip into the capsular fornix, you see that slight jiggle of the lens and bag, and that means that you're within the capsular fornix. You point the tip down, and you get a beautiful fluid wave. Again, this is a very reproducible and very easy way to do hydrodissection, and in my opinion, the best way to perform hydrodissection. So I hope this was helpful to you, and I thank you for your attention.